He's a PhD in medical robotics. He is not only involved in academic research, but also a co-founder of the company HandInScan that developed this very interesting Semmelweis scanner that was just object of this study. He is also associate to a couple of research projects in Austria. He has contributed to over 250 scientific papers, and he has been a great supporter of the Semmelweis Foundation of our conference since the very beginning. So I'm very glad to have you here, Tamas, and please, the stage is yours.
Thank you very much. It's a great honor and pleasure to be here again, and greetings to everyone. Good afternoon, and thanks for holding up with us. And as it was said, we have been really much supportive of this initiative, and I can be grateful enough to Semmelweis Foundation to putting this again together and providing all the needs and funds so that we can move forward. So in the next couple of minutes, let me share a couple of very recent research domains, because we have been trying to support and facilitate with our own means WHO's research agenda. So as Professor Pite said before, that there are many things that we still need to be done and investigate. And of course, COVID just reinforced that one thing is that we are always able to move forward in terms of hand hygiene, but the quality is another aspect. So if we look into the details, that now everyone knows that we are supposed to use alcohol-based hand rubs. This is really good, education ground zero level. And now we move forward, and that's what our startup company has been preaching for the past couple of years, that we need to teach people how to do it properly, whether it's WHO, 6-step protocol, or anything else. We care for the outcome, and we do want to make sure that you are covering your hands properly. But then comes another layer, and this is where WHO currently is pushing the research community, and this is where I'm going to present some new results, like how do we make sure that people are getting enough hand rubs so that they are actually able to cover their hands. And this is not as trivial as you would think, sir. Because if you start asking people, and we did that with medical students who ask, because they are the #1 targets of any such research, like what is the ideal volume that you should put on your hands? And there were like 3 major types of answers that we had collected. One was like, some people were able to quote some guidelines, or anything between like certain milliliters at least. Some others were able to, quantify it through the dispenser, whether it's, 1 stroke or 2 pushes or so. And I think this is most relevant to us, because it shows that some others are describing it their own way, but around a quarter of the people, they judge the amount to be used based on the application. And this triggered our mind, because earlier we noticed that many of the dispensers that are placed on the walls in the corridors of clinical settings, of what you took at general public places, they just don't give the right amount. You have to push them 2 times, 3 times, 5 times sometimes just to get the proper amount. So we did a thorough investigation over a year with my fine colleague, Mrs. Banshagi, and other colleagues from Geneva, and we managed to collect significant amount of data how dispensers actually work. The shocking results, while most of these dispensers are very stable and reliable when you put gel into them, but as soon as you put a liquid hand rub, they start leaking. What do we mean by that? The more time spends between applications, so you just leave it resting, the pump mechanism empties back, and the next time you push it, it doesn't give you the proper volume. How severe is the problem? Well, with some type of dispensers, it's very severe. So we understood that 32 types of the altogether investigated 17 different dispensers. They had serious issues, which meant they lost at least 20% of their volume within an hour. Why is that important? Because when you have this assumption that you do the right thing, you walk up to the dispenser, you want to get that amount to protect yourself, your patient against COVID, against anything else, you just don't get the right amount. What's even trickier here, that the more you look into the various dispensers, the more confusing you get, because some dispensers that they tell you the volume, you can adjust it and make like, oh, I want to get is through this diode, you can adjust to make it 3 mLs, for example. But factually, we will still give you the 1.2, 1.5-ish ml that they are just giving. And that means, again, like you had the perception that you do the right thing, but factually you are misled and you will never understand why you cannot do a proper hand hygiene. And even when you do so, very soon afterwards, minutes, you see, like after 10 minutes, the pump only gives half of that amount. So with under 1 ml, it's technically impossible to perform correct hand hygiene, as it had been shown by our previous research. So what was the conclusion here? That we should investigate our dispensers. So we have been moving forward with this issue, and the number one conclusion here that we have been proposing to the WHO POBS group, and then also to the new formulating ISO World Hand Hygiene Standard group, that we shall have normative requirements on the quality assurance of dispensers. We have now a new protocol which is under testing. Also a quick one in the hospitals. Within 20 minutes, you can test your dispensers and make sure that they are really functioning and there is no major infrastructure fault in there. And also we are recommending a more thorough test for manufacturers that they can perform with every batch back at their manufacturing site, making sure that there is adequate quality control for the community. If you're interested to join any of these follow-up studies, let us know and we will be happy to concur. But we shall not stop here. So once I got the right amount, what is the right amount? Because again, like WHO is very wisely only saying in their guidebook that a palmful of the product shall be applied. We all know that there are radically different sizes of hands, and we have been looking into that issue long time ago, like how could we make it objective? And through our digital technology, the Semmelweis scanner, we have been able to start doing objective measurements. So we did first and foremost a review on kind of like quantification of all existing hand size measurement methods. Actually, there was a publication last year that came out of it. So now we can really have a software which was calibrated running on the scanner to do the proper measurements. So you don't have to repeat it. You can just turn it on and immediately you get the proper size of the hands by square centimeter. Why is that important? Because according to our most recent study, which actually appeared last week online at ERIC, based on over 1,500 measurements, we could clearly show that the amount, the proper amount per hand size is a very important thing. So it's not just, again, like we are able to show, like, okay, thumbs are left out in different proportion of the people, but according to the different hand size, you really have to make the volume relative. Why is that important again? Because if you don't give enough to large-handed people, then they will not be able ever to rub in well. And we have seen some results here, and you start like we started with low volumes, and you see like, okay, 1 ml is definitely not enough, and but still you see like the average error that it resulted is just 7% of the total hand surface. But 7% average surface error, as you can see that on that image that we took as an example, is just enough to make a lot of spots missed out. So once you match it against this hand size, these are all the participants' hands, and you can clearly see, like female and male population have distinctly different hand sizes on average. We have to establish a brand new metric, and this is the relative hand coverage. And we now strongly encourage everyone to look from this perspective. Can we ensure that people are getting the right relative hand coverage, which could mean like a microliter per square centimeter? It's a little awkward, so we're going to probably rename it to just Semmelweis unit or something else, which people can easily remember. But this is, again, a relativized volume that people should be looking for. So why is that important? Because when you look into hand sizes and everything, you start looking into that average, and all of a sudden, you can see that people, according to different hand sizes, are able to do quite well with the given amount. And also when you ask them how does that feel, all of a sudden when it's just relative, you can see that people with larger hands feel more comfortable with getting more, and this is what we want to achieve eventually. And people with smaller hands are already content with less. And this is again like you can do a economic reasoning here, and of course you don't want to waste hand rub either. The number that we have derived based on these 1500 measurements is approximately 4 microliter per square centimeter. We will continue confirming that, and hopefully you won't have to run around again with a microscale and some other technologies, but automated dispensing mechanisms linked with, for example, our scanner, the Semmelweis scanner, will be able to provide that per person automatically in the near future. One other phenomenon that we started to investigate along these is dripping. So actually when you get your volume, it might start dripping. And when you ask people whether it dropped, the more you give them, the more aware they become. And we wanted to quantify that. And this is what most recent stuff, it has not been published yet, but it looks very promising that once we use ultraviolet again to trace the proper amount, we were able to see that, like with gel, of course, which is kind of no-brainer, less volume drops on the floor. So gel is more consistent from that point of view. But it's not consistent because apparently there are a lot of people who do not notice at all when liquid drips. It's really hard to notice whether your liquid is dripping. So we can be sure on that. But what's even more important here, and this is again ongoing research, the more you give to people, the more liquid will drop, not the gel. Nevertheless, even with that limited amount, people seemingly are better to comply with hand hygiene coverage requirements with hand rub. So we continue our investigations, but again, like don't give up on either gels or liquids yet, because there are going to be new results coming out, and I'm sure that by the next Semmelweis CE conference, we will be able to present you some brand new data on this. So finally, this leads us to the last point here, which is the drying time, and we have been really much able to show that it is again like we are not there yet. The general 20-30 seconds, which is now under question by WHO as well, it's just not easy. It doesn't only depend on the volume, on the hand size. There could be other intrinsic and extrinsic factors which are now under investigation. So if you want to learn more, come back next year or just keep asking us. Thank you very much.
Tamas, thank you very much for this very precise and good presentation and a very structured approach of looking into data of things that nobody has looked at yet. The volume that is necessary, the dripping, the drying time, and these things. I think these are really data that help us to move forward. There is one comment in the chat from Finland, and I'll read it to you. It is good that there are equipment for analyzing hand hygiene like this HandInScan, but we should also have precaution of other things like short nails, nail polish, rings, watches, etc.
Absolutely. I mean, that's another ongoing research. With the limited time, I have not been able to cover that. But again, like come back next year, and I'm sure you're going to learn more about that as well. And we are closely looking at that. So if you're interested to join our research team, you're most welcome to contact us.
Absolutely, and we also hope that we can meet in person next year and that we can exchange new data from your research. There is a second comment that was referring to one of the previous lectures from Finland. Just a general comment: double gloving is strictly forbidden in Finland. Hand disinfection before and after gloves, simple and easy. No other ways of using gloves. So this is something that I think is very important. That's why I wanted to add it. Thank you very much, Tamas. Excellent job, and let's stay in touch.